In general, WHO recommends that the wearing of a mask by a member of the public is to prevent that individual giving the disease to somebody else. We don't generally recommend the wearing of masks in public by otherwise well individuals. There is no specific evidence to suggest that the wearing of masks by the mass population has any particular benefit. In fact, there's some evidence to suggest the opposite in the misuse or wearing a mask properly, or fitting it properly, or taking it off, and all the other risks that are otherwise associated with that. And there also is the issue that we have a massive global shortage, and where should these masks be, and where are the best benefit? Because one can argue that there's a benefit of anything, but where does a given tool have its most benefit?
Our position right now is that put a mask on someone with symptoms if they should need essential services. Like if you have symptoms, you have to stay at home. You should not be wandering around the community. If you need to get to a medical facility, at that point in time, that mask might actually be useful, because you now have infectious droplets that you might send to others. But the key is to keep that 2-meter distance. Masks have to be utilized appropriately too. Most people haven't learned how to use masks, so there's many practical aspects of this. So our advice right now is there is no need to use a mask for well people.
If you are going to re-engage right now, please wear a mask. A mask is a very good tool for that. And I have not heard any science that says it's not. So I don't even understand how there's a real argument. I haven't heard any science that says that is not a good idea.
In any science that says that the mask is a problem at all? Really? Well, then obviously you didn't see this article by the world-renowned scientist, Dr. Russell Blaylock. Here's a couple of quotes from a brilliant article. Blaylock, can I go back to that title really quick so people can find it? Face masks pose serious risk to the healthy. Listen to this. As for the scientific support for the use of face masks, a recent careful examination of the literature, in which 17 of the best studies were analyzed, concluded that none of the studies established a conclusive relationship between mask, respirator use, and protection against influenza infection. As for, several studies have indeed found significant problems, however, with wearing such a mask. This can vary from headaches to increased airway resistance, carbon dioxide accumulation, to hypoxia, all the way to serious life-threatening complications. While most agree that the N95 mask can cause significant hypoxia and hypercapnia, another study of surgical masks found significant reductions in blood oxygen as well. In this study, researchers examined the blood oxygen levels in 53 surgeons using an oximeter. They measured blood oxygenation before surgery as well as at the end of surgeries. The researchers found that the mask reduced the blood oxygen levels significantly. The longer the duration of wearing the mask, the greater the fall in blood oxygen levels. And lastly, studies have shown that hypoxia can inhibit the type of main immune cells used to fight viral infections called the CD4 T lymphocyte cells. This sets the stage for contracting any infection, including COVID-19, and making the consequences of that infection much graver. In essence, your mask may very well put you at an increased risk of infections, and if so, having a much worse outcome. There's actually one more. When a person is infected with a respiratory virus, they will expel some of the virus with each breath. If they are wearing a mask, especially an N95 mask or other tightly fitting mask, they will be constantly rebreathing the viruses, raising the concentration of the virus in the lungs and the nasal passages. By wearing a mask, the exhaled viruses will not be able to escape and will concentrate in the nasal passages, enter the olfactory nerves, and travel into the brain. You understand viruses at a very, profoundly microscopic level. You've been watching this COVID-19. I have a lot of questions for you. But I wanted to start the discussion with masks. Russell Blaylock is a world-renowned doctor who's come out and said there is a danger to wearing these things. Do you agree with him? What are your thinking when you look at disease profiles and viruses and bacteria? Are masks effective at keeping us healthy?
So I would say it's the third slide there. There's a table that just compares coronaviruses with Ebola viruses. So if it was an Ebola virus outbreak, then a mask would be affected because Ebola virus is transmitted through the air. But in the case of coronavirus, it's not transmitted through the air, it's transmitted through droplets that then would drop on the surface like a door handle. So in coronavirus, there is absolutely no need to wear a mask. And also that means there's no necessity for coronaviruses. But also I entirely agree with Professor Blaylock, who has an outstanding track record and is very experienced in this area, that because the mask is covering you, you have less oxygen, and that puts your immune system under stress. And then the latent viruses that are in your body, because you're under immune stress, will reappear. And not only will you have more coronavirus, but if you had other latent viruses, it would allow them to reemerge. And the reason why they reemerge is that nutrition and vitamins and stress are very important to have good nutrition, have very little stress on the body, and ensure that you have vitamins to keep your immune system working. And in this case, in coronavirus, the immune system can clear the virus within, 10 or 11 days. So I would definitively say for coronavirus, there is no need for masks, and also there is no need for social distancing. So I'm actually looking in Ireland to see whether we can take precedence cases against, legally, because the government scientists, and our Taoiseach is a doctor, and the Minister for Health, that they are making policy decisions that actually will make people sicker.
Use of non-medical masks or face coverings is recommended as an added layer of protection.
In situations where you cannot physically distance to 2 meters, people are encouraged to wear masks.
If two people are wearing masks, I'm protecting you and you're protecting me.
When possible, we highly recommend that people wear a mask.
I think adding on this layer as we learn more was the appropriate thing to do.
You could soon see a lot more people wearing masks. Today, the Chief Public Health Officer, as we were discussing with Dr. Hankins, officially recommended Canadians wear them in public when physical distancing is at risk. Also in Ontario, masks are now recommended for anyone using public transit. Here's Provincial Transport Minister Caroline Mulroney making that announcement.
On the advice of Ontario's Chief Medical Officer of Health, we are recommending anyone traveling on public transit wear a face covering to help stop the spread of COVID-19. However, there are exceptions. Face coverings should not be placed on or used by children under the age of 2, anyone who has trouble breathing, and anyone who is unable to remove it without assistance.
Obviously, everyone's situation will be different, and we always need to pay attention to public health authorities. When it is possible for me to keep 2 meters distance from people, that is what I prefer to do. In situations where I'm either walking through the halls of Parliament or going to my office and coming in proximity to people, I've chosen to start wearing a mask. I will be wearing a mask as I go into Parliament this afternoon for our in-person sitting. Once I am at my desk in Parliament and 2 meters separate from everyone else, I will take off my mask so I can engage in parliamentary discourse. But as soon as I leave my seat and walk past people and walk through potentially busier hallways, I will be wearing a mask. That's my personal choice. That is aligned, I think, with what public health is recommending. I think we all need to adjust to what works in our circumstances and keep safety at the forefront of what we're doing.
Yesterday, Dr. Tam said one should wear a non-medical mask if physical distancing was not possible, but there's still a lot of confusion about when and where one should wear a mask. Maybe you could clarify for Canadians regarding non-medical masks, whether a person is pre-symptomatic or asymptomatic, should they wear a non-surgical mask when they go outside, even if they think they can physical distance?
I think those are exactly the kinds of questions that people should be taking the advice of medical experts from. I am not a medical expert. What I have heard from medical experts is that the most important thing is for people to stay home. If they do have to go out, they need to keep 2 meters apart and look to go out as minimally as possible. We need to wash our hands regularly. We need to cough into our elbows. These are the things that we know will slow and arrest the spread of this disease through this country. My understanding of what Dr. Tam explained yesterday is that if people want to wear a mask, that is okay. It protects others more than it protects you, because it prevents you from breathing or speaking moistly on them. Oh, what a terrible image. But it actually is something that people can do in certain situations. Our focus, though, is making sure that people don't think that wearing masks can mean that they don't have to social distance as much or can go out more often. The advice remains: stay home and keep 2 meters apart. Come on.